Good morning, and thanks everyone for joining us. Thanks for the opportunity to speak with all of you. I did want to take a moment of course, I'm going to address the mass vaccination efforts throughout the county, but I wanted to take a moment before I start that update to recognize our partners in human services, economic development, and the other sectors who are all doing amazing work in response to COVID-19 and helping keep our community safe and healthy as well. And a reminder before I forget that today is the last day for our current round of small business grants. Those close today at 5 p.m. So I wanted to make sure I highlighted that. There is a lot of work happening throughout the county. The mass vaccination effort is one significant piece of it, but there is other work going on. So I wanted to recognize those partners who are doing that work throughout the community. The primary thing I wanted to discuss, of course, is our mass vaccination efforts. As most of you know, we began planning for mass vaccines distribution throughout the county back in late July, early August. At this point, with our partners from the fire EMS community, from Snohomish Health District, our law enforcement community, community partners in cities, and our healthcare systems, we now have 5 sites that could be available to provide mass vaccinations for members of our community. I have to emphasize could be available because unfortunately we do not have the vaccine supply to keep all of those open. And I know the news was shared earlier this week that 3 of those sites were closed due to lack of vaccine availability. 1 is ready to go, but we haven't even opened it yet because of lack of vaccine availability. Our team has worked really diligently to make sure we have capacity. Our original goal was to be able to provide vaccinations for up to 50,000 residents per week. We believe we can easily do that when we have all of the capacity in place. The capacity we're planning really focuses from a mass vaccination perspective on 4 drive-through sites and 3 walk-in sites. That combination gives us, we believe, the best coverage for the county, as well as allowing folks who may have mobility challenges or other issues to be able to access sites that they otherwise can't get to. The team has worked very hard together to make sure we have staffing and equipment for those sites. Our fire and EMS partners have been working primarily in developing the drive-through vaccination sites, and our partnership with Seattle Visiting Nurses, Fire EMS, the Health District, and other providers within Snohomish County have been working to establish the walk-in sites that will begin to open as early as this week. I can't emphasize again enough how much is contingent on the availability of vaccine, and I know Dr. Spitters will speak in more detail about that. We have heard the frustration around the lack of appointments and the scheduling system for appointments. One of the decisions that we made early on was to not schedule appointments unless there was vaccine available. So for many folks who are frustrated at the lack of appointments, that correlates directly to the amount of vaccine we have available. We did not want to put the community in the position of waiting in a long line, hoping they would be able to get vaccinated, only to find out that we would run out of vaccine at a site and have to turn folks away. So that was a decision carefully considered and implemented. We are aware that there are a number of folks who received first vaccinations at, in particular, our Monroe site. We are working diligently with a new technology that we will be rolling out to make sure that folks can get their second appointment scheduled, and also a technology that will allow us from the outset to schedule first and second doses at all of our sites. And we believe we'll be able to create a wait list with that technology as well. We are hopeful that that will be in place by the middle of next week at the very latest. But we're hopeful, I'm very hopeful that we'll actually have it in place even before then. So we do have a lot of capacity. We unfortunately do not have a lot of vaccine. I appreciate the team and the partnerships that we put in place, in particular with the Snohomish Health District. And with that, I will turn it over to Dr. Spitters to go into more detail about the vaccines. So.
All right, well, thank you, Jason, and good morning, everyone. Just as Jason highlighted with the mass vaccination sites, We're seeing the same issues system-wide in Snohomish County. We've now have 93 providers that have been approved by the state health department to provide COVID vaccine. Those providers, in addition to the high throughput possible at the mass vaccination sites that Jason cited, means that we have more than enough capacity to safely administer 50,000 or more vaccines per week. The good news is that we now have more than 61,000 people who have received their first dose and close to 30,000 who are fully vaccinated. So this week, but the problem continues to be the supply of vaccine. Last week in the county, we received roughly 17,000 doses. Of those, about 11,000 were for first doses, and the remaining 6,600 that we got were for second doses. This week, we are tentatively scheduled to receive countywide a similar amount, about 15,000 doses, with 9,000 for the first dose, 6,000 again for the second dose. So if you think about the numbers, that's 9,000 doses and 100,000 eligible people hoping to get vaccinated. So it's just a fraction of what we need it to be to satisfy the demand, to address the frustrations that everyone's experiencing, and to fulfill the desire that everyone in the county must have to, or most everyone must have to be vaccinated. And so that's what's leading the frustrations, the heightened stress levels in our community, and what feels like, trying to find the golden ticket to a vaccine appointment. So we hear you, we understand it, but right now the numbers are just not in our favor for more than about 10% of people to get satisfied this week. 10% of eligible people. We're in the final stages, as Jason mentioned, of rolling out this new technology, which should help with some of the scheduling frustrations that we've been hearing about. And that, the inclusion of a wait list option, if that comes to fruition, I think will also help reduce people's stress and frustrations. We'll share more as that becomes more ready to launch, but please know that we're all working together with DEM, the health district, the state health department, our community partners to improve what is in our control, and then just hope for the best in terms of the vaccine supply bringing us to further down the road. So when we do, we share and we forward those frustrations with our partners at the state and federal level. So it's, we're not letting your concerns and frustrations, suffer in silence. Leadership at the state knows we can handle more, and our federal delegation knows we can handle more doses as well. We just need that supply chain to grow more quickly. One last point on vaccines is regarding the second dose. We still continue to get questions around second dose allocations and appointments. Second doses are allocated and ordered separately from first doses, and those are sent directly to the provider. No second doses should be saved from first dose allocations. That's a message to the vaccine providers. That's not something in the community's hands. Only designated second doses should be set aside, saved for, and used for second doses. For those who have already received your first vaccine, please work with the same healthcare provider, clinic, or pharmacy to schedule your second appointment. We're also doing outreach to providers to clarify their initial and follow-up scheduling practices to help ease some of these pinch points for residents trying to get vaccinated. Now I want to switch gears to talk about the broader COVID picture here in Snohomish County. We're glad to see the numbers continuing to decrease. The 2-week case rate through last Saturday, January 30, dropped yet again down to 184, more than 50% now off of the peak several weeks ago that was in the low 400s. Hospitalizations, long-term care cases, long-term care outbreaks, and deaths are also decreasing. Because of that and similar trends throughout the Puget Sound region, we have now moved together with King and Pierce counties as the Puget Sound region into phase 2 of the Roadmap to Recovery plan. We know this is also welcome news to business owners, employees, schools, and the county at large. This easing of restrictions is good for our economy, our children's education, and so many other social and health needs in our community. It also means that everyone must be diligent with following all the precautions to minimize the risk of exposure and transmission while being able to take advantage of the privilege of increased opportunities for social, commercial, employment activity. This is particularly important, though, as we head into the Super Bowl weekend, which is commonly a time of big gatherings. I recognize that many people may be, stir crazy, cabin fever, call it what you want, tired of staying home and mostly being alone or being with the people they live with, and are looking forward to the opportunity for fun outings, gatherings with friends and family. Please just remember that Super Bowl or other endeavor, other gathering, remember the phase 2 guidance. Indoor gatherings of no more than 5 people outside your hospital, outside of your household are possible, and a maximum of 15 people for outdoor. So indoor, 5 people outside your household, outdoor, 15, and the limit on the total number of households that can be aggregated there are 2. So you can't bring in a third household. If you're going to a local restaurant to watch a game, indoor dining is available on a limited 25% capacity with a maximum of 6 people per table and a limit of 2 households per table. Regardless of how you celebrate, face masks and physical distancing still apply when you're around people you don't live with. So now's the time to crowd around the TV for the big game, spread out the fans, keep the masks on when not eating or drinking, keep it smaller than you otherwise might have in the past. And speaking of eating, no double dipping, as it's been referred to. Don't reach back into the food container. Either bring your own food or have separate plates with one person who's serving. That reduces the amount of possible contact and transfer of virus through inanimate objects, food, what have you. The goal is to limit the number of places where a lot of people get together and are touching the same surface and breathing the same air. So enjoy, but let's keep it limited. Also, wash your hands frequently, especially before and after eating, with hand sanitizers as needed in between. Enjoy the day, but make a smart play calls. And did I forget to say, keep your masks on. The roadmap to recovery is for a 2-week period, with the next data going to be published on February 12th. We don't want to move backward, but that will happen if we're not careful. We're only in control of the numbers. Once the numbers are there, if they go up, we're going to end up moving back. So the region must continue to at least meet at least 3 of the 4 metrics to remain in phase 2. It's really on us all to make wise decisions for the sake of our local businesses and neighbors. Please be patient as well with this vaccine rollout. Health district staff, DEM, and other partners are working hard to navigate through all the bumps in the road. Even under the best of circumstances, like the 50,000 doses per week that Jason mentioned, it's still going to take us up to 6 months to achieve vaccination of everyone who wants it. We've done this before, we can do it again, so we just ask for your patience and attention. And now I'll turn it back over to Kristen so we can answer some questions.
All right, well, let's see here. Our first question, Dr. Spitters, even though the UK variant is here first, what's your sense it and the South Africa variant might compete for predominance, since both are supposed to be more easily spread? And do you think we're doing enough to surveil for the variants, and what should we be doing?
Yeah. Well, the main concern, of course, is that whether it's these strains you've mentioned or some future strain, entering the community, is increased transmission can mean more cases. If it also carries with it increased severity, it can mean not only more cases, but more severe cases. And in either one of those situations, it can push the hospitalizations back up. So the main thing, again, for all of us to practice all those prevention measures I just mentioned. In terms of containment efforts, right now, the Centers for Disease Control's guidance remains the same for all strains. We are reassured that the B117 strain from the UK, or apparently from the UK, that's certainly where it's taken hold, does not, vaccine-acquired immunity should be fine to control that. They're not really concerned about the South African strain evading immunity, even though I would say the potency of the vaccine-acquired immunity is not quite as great for that strain, at least in the test tube. We'll have to see what happens as vaccine rolls out, the impact on that strain. Where the surveillance for these strains is coordinated. It's fomented by the federal government, coordinated and run by the federal government in partnership with state public health laboratories and their partners, their laboratory partners throughout the community. I am not in a position to comment on the adequacy of that. I think the fact that they've detected these and that they're, all eyes are on this. The state health department, I know, is working on expanding its capacity to contribute to that process. And I think, if you have more questions about that, I would address those to the state health department.
Next question. Do you think teachers should be moved to the current phase of vaccinations, phase 1B, tier 1, or do you think schools are safe enough settings?
Well, I mean, listen, every day, including from the teachers, we get compelling and rational arguments from various sectors about, the potential benefits to that sector and society from changing their order, changing the order of the prioritization. And, reasonable minds can differ, but I think a lot of good thinking by people with broad view, trying to address both the societal benefits, which is the number one goal here, the societal benefit of interrupting the emergency, taking a look at that, equity issues, accounting for both populations that are disadvantaged or poor, or who are essential workers. And, I just, that work's already been done. That's all I can say. And I support the structure that's there. And I understand that those who are not as high in the priority structure as they would like to be, or they feel justified, they feel that it's justified, may be frustrated. But we've got a system, it's rational. I don't think any system will be perfectly accepted by everyone, but we've got to move ahead and proceed. Our schools continue to have cases, predominantly single cases in them with occasional clusters, but the evidence, I think, from around the world, from the US, and the corresponding guidance based on that science and observation is that, schools can, that the prevention measures in place can keep teachers, staff, and students reasonably safe as we buy time and move ahead. And then when their turn comes up, then absolutely, we want to get them vaccinated as quickly as possible.
Is there a guarantee that someone gets a second dose in the appropriate amount of time?
Okay, well, this is another one of the bumps in the road of what we're going through. Again, this whole endeavor, we're blessed with a great leader here in Jason Biermann, who's got a lot of emergency management experience and, has the skills and experience to take on something that's brand new like this and work with us to get it out and work with the healthcare community. We hear the frustrations about certain settings where people got their first dose and didn't get scheduled for their second dose. The guidance from the federal government and from the state health department that we are in harmony and really betrothed to continues to recommend a second dose, ideally 3 weeks after the Pfizer or 4 weeks after the Moderna, ideally within 6 weeks. But even if it's delayed beyond that due to the logistical challenges and supply chain issues that we're facing, even if it's delivered beyond that timeline, there's no need to restart the series and get another first dose and then a second dose. So I realize it's frustrating, but I don't think it's dangerous what's going on with these challenges. A lot of, again, reasonable minds will differ, but some very astute and experienced vaccine experts from multiple settings, when looking at the data from the phase 3 trials, those are the pre-implementation trials that authorization to use the vaccine was based on. If you really look at the data, after about 10 or 12 days following the first dose with either vaccine, the number of new cases in people who got the vaccine before they got the second dose was very limited. Whereas in those who got who did not get the vaccine, they got the placebo, then after a couple of weeks, they keep getting more cases, right on through. But the folks that even after one dose, about 10 or 12 days later, which is about how long it takes the vaccine to work, the lines in the experience between those who got vaccinated and who didn't separate widely. And the estimated short-term benefit of that single dose is about 90% efficacy. And so as we're trying to interrupt an emergency, on the one hand, we want to do the best we can for all individuals, try to optimize their personal medical experience by getting that second dose as soon as possible. But if it doesn't happen, right on time as planned, it's not going to be a big failure. It's still good protection, and then we'll keep trying to meet that goal. But we understand the frustration. But I would like to sort of encourage people to recall that even one dose provides great protection, at least for long enough for us to get around to that second dose. And even if it's beyond 6 weeks, we want to aim for it quickly. But if it doesn't happen, don't feel like you're hanging out there unprotected. That would not be an accurate impression.
Is the lack of supply a federal problem, a state problem, or both?
It's our problem. We're a society, and let's stop trying to, figure out the right direction to point the finger at. We've got an incredible scientific community that led to 2 vaccines that are currently available, many more on the way. The manufacturers, the federal government, the state government, your local government are all trying to make this work to get it out to you. And it's bumpy. And it's the first time we've done this in our lifetime, in our generation. I just urge, let's focus on trying to get through the bumps, trying to tolerate it. And I'm not going to worry so much about figuring out who's to blame. I don't think that's going to help.
Do you think the 17,000 doses Snohomish County was allocated last week was a fair portion?
It's the portion we got, and we've got to work with what we get. We're working with the state health department. They have, they get vaccine requests from us at the health district as well as from healthcare providers and all around the state, local health jurisdictions all around the state. And then they've got to balance the, whatever it was, I think 90,000 or so doses that they got last week and spread them out in a way that they think is going to do the most good for the public health of the state. And it's not helpful for me to, Monday morning quarterback what they did last week. Do we want more vaccine? You bet. We want enough vaccine to fill up those 50,000 slots a week. And, we remain hungry until we get them.
Why was the decision made to schedule people for first doses but not second doses?
Yeah, I can take this one, Dr. Spitters. So that's not true across the board. There are different providers providing support at the different mass vaccination sites. Because of the different providers, we have different systems that they're using until there is one comprehensive system. They have different systems they use to schedule. As I mentioned, the one provider, the fire EMS community, primarily at Monroe, we fielded a system quickly so that we could get them out at the vaccine site providing vaccinations. And that system, at least as we rolled it out quickly, we focused on getting the first doses scheduled. So that decision was made so that we could get vaccines moving faster. We knew that we were going to have to go back and make sure that we connected with those folks who had their first dose, who received their first dose. But that decision was made so that we could get vaccines out into the community faster instead of waiting for a technology solution that would catch up to make sure. It's more labor intensive to do what we did in terms of we do now have to go back and identify folks and schedule second doses, but we wanted to make sure we got those first doses out quickly. You're muted, Kristen.
Sorry about that. Can you talk a little bit more about the people receiving a second dose? Is there an issue beyond scheduling, and why was the Monroe site called out in your comments?
Yeah, that's what I was just mentioning. Our provider at the other initial two sites had a system that scheduled second dosing when they scheduled first dosing so that we could get vaccines out more quickly. We made a decision to implement a system that could get the first doses out faster in Monroe. And we are now in the process of reconnecting with those folks who received their first dose at Monroe so they can receive their second dose.
All right. Given the frustration and anxiety from older folks who don't have internet access, has the county considered setting some appointments aside at the call-in center for these individuals?
Yes. So first, we do have a call-in number that we can share with folks, that people who are not internet savvy or don't have access to technology, where they can call in and they can get help getting scheduled. As I mentioned in my initial remarks, appointments are correlated directly to vaccine availability. So without a lot more vaccine, the appointments go quickly. We are and have been for weeks now looking at, when we have enough vaccine, allocating some that we will actually specifically for folks 65 and older, so that certainly as we move into the next tiers of phase 1B, that we will have days, sites, and or hours at sites set aside for folks who are over 65 so that they can come in and there will be a dedicated time for them to come in, similar to what some of our large big box stores and others have done, to have separate hours for folks who are more at risk. So we are looking at doing that so that we can accommodate those folks. Again, right now, we simply don't have enough vaccine. We're just trying to get through the little bit we have quickly, and we don't have enough vaccine to implement that just yet.
All right. Jason and Dr. Spitters, please spell out clearly your concerns if it is possible we could see increased hospitalizations and deaths attributed to vaccine shortages.
Well, I think that there's a, it's kind of respectfully that I would reframe the question because the way stated, it kind of conflates issues. The virus is transmitted by people coming in close proximity with others who are infected. So our prevention measures, face coverings, limiting gatherings, social distancing, hand hygiene. That's the front row plan for interrupting transmission. Failures in that lead to transmission. Ultimately, vaccination covering the sufficient proportion of the population to interrupt transmission would render those measures less necessary. Everyone who gets vaccinated right now needs to continue those, but then we'll reach a point where it's no longer necessary and we can let that down. So I think the faster we get vaccine in our hands and then into the arms of people, the sooner we can progress to a lower level of prevention efforts, a broader level of economic, social, educational activity. So that's the vaccine supply is really going to drive how fast we get to our desired destination as a society. In the meantime, it's in everyone's hands to continue to do what we got to do to interrupt transmission, and failures in that will lead to increased hospitalizations and deaths.
Given the presence of the new variant in the county and the limited protection provided by just one dose, would Snohomish County prioritize vaccinating as many people as possible with the first doses before giving their second dose?
So first, the vaccine administration policy, the standard of practice is established by the Advisory Committee on Immunization Practices with the Centers for Disease Control. These are lifetime career experts in various aspects of immunizations. And, it's in their hands to establish what the standard of practice is, and then we implement it. I will say, I would just hearken back to the comments to provide background for folks who have only had one dose, particularly those who have only had one dose yet and who are in high risk for severe disease or high risk for exposure. The data from both the Pfizer and Moderna trials shows that, after waiting a couple of weeks, which is, then when cases did occur in both the vaccine and the placebo groups, because they had acquired infection before they got vaccinated and they were just incubating. But if you wait out that period, 10, 12, 14 days, then the lines diverge and the people that got placebo kept getting COVID, and we saw very few cases in the vaccine recipients. So I would say it's not accurate to say that one dose provides only limited protection. I think it really provides it, for some unspecified time, probably on the order of months at least, protection that's in the 90% range, which is not the ideal for the individual. We want to get that second dose, get it up to 95. But as a public health interim measure, it's a arguably reasonable outcome and pretty darn good also at the individual level, better than most vaccines. So there you have it.
Do you expect the mass vaccination sites to close again until supply increases? And what is being done to try and get more vaccine to Snohomish County?
So I'll start, and then if Dr. Spitters wants to add. Do we expect them to close again? That's completely dependent on the supply of vaccine. We certainly hope they don't. But we're also sensitive to our partners and the work they're doing, and we're certainly not going to ask them to open a site and staff it when there's no vaccine available, nor do we want to, communicate to our residents that we have sites that are sitting staffed, but without any ability to push out vaccine. So while we hope they don't, it is week to week still in terms of how much vaccine we're getting. We don't have a consistent, stable number yet that we're able to plan ahead for subsequent weeks on. So they may close again, but we certainly hope they don't. We are communicating regularly. I know through both the Department of Health, through the governor's office, and through state emergency management, our capacity and what we're able to do, and letting them know our ability and how many folks we could be vaccinating. So there are multiple times per day, I believe, communications going through different channels to communicate with the state, again, through those different areas that we have the capacity that we've made, that we've created with our partners. And so we are reaching out directly, consistently, to let them know we've got capacity waiting to be used, and we just need vaccine to be able to make it, to open it and get it going.
Now that doses are going to pharmacies like QFC and Costco, will the health district be providing a breakdown of where doses are going in the county?
Yeah, there's, I don't have an answer for you in the moment. I know we for security reasons, we had been blurring where vaccine is showing up, because we want to, preserve order and access at those sites for people who are there to get vaccine, as well as those people who are there for other services. And what the future of that approach is, we'll let you know in follow-up. I understand the desire on the one hand for transparency, and on the other hand for the facilities to not, get either inundated or feel other convenience or security threats as a result of that. So I don't have a clear answer, but there's multiple interests at play, and we'll do our best to be a good steward of the information. Do you know more about that, Jason? Do you have, okay.
Can you go over which vaccination sites are currently closed and give a quick rundown of the reasons and when they're estimated to reopen?
Sure. So we currently have 5 sites that could be in operation. Today, only one of those sites is operating, and that's the one at Arlington Airport. The Painfield location, the Edmonds College location, and the Monroe site are all closed due to lack of vaccine availability. The 5th site is at Boom City. We actually have the equipment and all of the planning in place for that. It has not been opened at all, simply because of lack of vaccine. We haven't had a need to set it up at all. There's simply not enough vaccine to justify setting it up. We estimate that the 4, so the 4 minus Boom City, will be open tomorrow. And again, that's vaccine dependent. And I have to mention a couple of things, I guess, also for clarification. Even at the amount of vaccine we're getting, many of these sites at their capacity of operation would go through that amount of vaccine within 1 day. So we do meter that out to try and allow folks more flexibility with when the appointments are available. And secondly, just a reminder for folks to keep in mind, there are also providers, Dr. Spitters mentioned, there are a number of providers throughout the county, physicians, clinics, others, who are also authorized providers, and pharmacies, I should mention those as well. So our mass vaccination sites are simply one piece of this overall effort to get our community vaccinated.
Has the county or health district made any contact with Providence concerning the private access clinic they hosted last week?
Well, we are the local public health agency, and we're working with DEM to coordinate the vaccination response. We're not the vaccine police. And I think that the public statement that Providence made about the event and their recognition and acknowledgement of the concerns that it raised and the feedback that it garnered did hit home for them, and they expressed regret about that. And I think that speaks for itself. Meanwhile, Providence Hospital, and the system is an integral part of our healthcare system. They've contributed not only to the care provision of patients in the hospital, but they helped for a while staffing our isolation and quarantine facility. They're potential partners in future mass vaccination efforts, and it occurs to me that they are a great community partner in this COVID response, and that there were elements of that event that upset people, and that given the feedback that registered with Providence, and they expressed regret, and I take that at face value, and I think we got to move on.
A question about the small business grants for Jason. How many businesses have applied and been approved? And how many more businesses do you believe the grants could support?
Yeah, and I'm sorry, I'm going to have to defer on that and ask folks patience with getting those numbers to you. We can certainly follow up, but I don't have that information off the top of my head.
All right, Dr. Spitters, there are several preprints out there that appear to show the better strategy for the collective US is not to only focus on vaccinating the elderly first, but to also give smaller doses to younger people who do not seem to require as much vaccine. Have you heard of these findings, and is there any discussion about shifting that way given the limited vaccine supplies?
Good question and fair question. First, just for anybody in the audience that doesn't know what preprint means, that means a completed study that's been all written up and is either ready for submission or has been submitted to a scientific journal for publication, but it has not been reviewed and vetted yet or approved for publication based on its scientific merit and accuracy, perceived accuracy. So these are pre-reviewed publications. So there's that. I haven't heard about this particular line of inquiry, but I think it just raises the general notion of, is the standard recommended approach of vaccine administration for the ideal outcome for the individual, the best for society in the midst of an emergency. I think that another area where this has come up is, should we really be trying to get 2 doses into everyone as we go along, or should we get 1 dose into everyone and then work on getting the 2nd dose into everyone? And these are difficult questions over which reasonable minds looking at the same data will differ, but these are not decisions that are in my hands, but they are in good hands. And there's a discourse and deliberation that's going on out there over these issues, and I think that let's keep it in the hands of the Advisory Committee on Immunization Practices to look at this stuff. They're the ones that historically have done an outstanding job of guiding us in our vaccine practice and establishing the clinical standard of practice for us and other healthcare providers in the community. This strategy that you mentioned, as well as the one I mentioned, and potentially others that'll come up, are best vetted by people at that level with a harmonized response nationwide. And meanwhile, we've got to run the plays that are in the current playbook.
Any update on how vaccinations are going at long-term care homes?
I'll speak to that a little, and then Jason may have a little more from his end. The long-term the skilled nursing facilities, also known as nursing homes, assisted living facilities. That's more like supported living for elders living in apartments or, still in one building. Those are being reached largely by the federal partnership with CVS and Walgreens that will then vaccinate the staff and residents of those large facilities. And we don't have visibility yet on that. I know that the State Department of Health has been communicating to us that they're trying to figure out a way to get information from the federal government about statewide and ideally county progress in that terrain. I can tell you anecdotally, we are hearing about many of the skilled nursing facilities and assisted living facilities that we interact with through our containment efforts are being reached by that, but I don't have anything quantitative. And then I want to turn it over to Jason to talk about outreach to what's going on with these smaller adult family homes and other efforts DEM and its partners are making in that direction.
Yeah, thanks, Dr. Spitters. So in addition to that, we are working with partners to go to the adult family homes, and those partners include our human services, the Snohomish Health District, and the Fire EMS community. So I know they reached 15 adult family homes yesterday. Again, it comes back to vaccine availability. We're spreading vaccine among the pharmacies, among the healthcare system, among these mass vaccination sites. So they were able to do 15 yesterday fairly quickly. We think we could reach the rest based upon what they reported this morning if vaccines were available within a week or two. So we're going to continue to vaccinate those adult family homes with our partners as we get vaccine available. And that's kind of the ongoing issue is just vaccine availability.
Can you tell us how many of the doses this week are going to the mass vaccine sites as opposed to our private providers?
I believe it's 3,500. If I'm wrong, we'll get back to you and correct that, but I believe I heard 3,500.
All right, and our final question, do you agree with the metrics that the governor is using for the Department of Health to make decisions on regions moving forward or backward a phase? And also, many people are still very scared about the variants when it comes to going out to eat with indoor dining, even at 25% capacity or schools reopen. Given what you know right now, are you confident that it is safe to ease these restrictions and have the county in phase 2?
So again, this is another area where, we certainly contribute and participate and comment on the state health departments and the governor's various lanes of guidance and direction as they come out. Usually where local health departments are partners in that. But then, once it's done, we got to live with that and implement it. And so, I can live with it. It's working out okay for us. We're moving into phase 2, and I don't think it's helpful to belabor the details. So it works for me, and I think it's working for the community and the region. And let's give it a chance to work. It's going okay so far. Having said that, people's comfort level is going to vary, just as with any non-zero risk, which dining out is a non-zero risk. I can tell you that it's certainly at least 50% safer than it was a month ago to do such activity, just because transmission's down, the probability of encountering someone who's got COVID is lower. Having said that, if you're gonna dine, for sure, wear the face coverings, keep them on when you're not chewing or swallowing, drinking, eating, put it back on, and with good ventilation and proper adherence to all those, specifications I gave earlier, that's the best we can do. And I think that's reasonably safe, certainly safer than it was a month ago. That's why we moved into phase 2. And people who want absolute guarantee about zero risk, we're not there. So then you have to make decisions for yourself from there based on that.
With that, thank you again for joining us today and for all of your great questions. We're going to wrap up, and please stay tuned for future media availabilities.